Faithful readers of the Brainstorm Health Daily will recognize this gentleman not only as this great investor, but also as one of our authors, right?
On a slow news day.
On a slow news day. We waited until we had a slow news day. But, you wrote about the challenges of being sucked into pattern recognition, this idea that, we're all obsessed with the idea of finding the next pattern. That's what a lot of this technology helps us do, is suss out patterns. And you, as an investor and as somebody who's going to take a very big risk in some of these, have to be a little cautious of that, right?
Yeah, so evaluating technologies, companies, et cetera, is, I think, frankly, more imagination than it is evaluation. Right? And pattern recognition is sort of evaluation, right? You're like, okay, I see this looks kind of like that over there, and I can evaluate it. Really interesting things happen when you can imagine what might occur, and you're right, obviously. But you have to imagine both the upside and the downside, right? Because you're constantly trying to figure out risks and how do I avoid them and how do I build on things. So for me, the really differentiated part about what I and other investors try to do is the imagination side of the equation.
Yeah. I mean, you talked about, when you recognize, a huge part of what you do is have to recognize the person at the heart of this invention, not so much as the invention. Like, you bet on leaders, you bet on individuals. And you tell one story about a technology that needed the world supply of oligonucleotides. Do you want to tell a little bit about this story? Yeah.
So what Cliff's referring to is that happily some percentage of the companies that I invest in have been successful. Most of those were successful not on the first thing they started with that I invested in, which calls into question how good I am at evaluating things, but let's leave that aside for now. Illumina, when John Stoltnagel and Mark Chi and Tony Zarnick got it started back in '97 or something. About a year in, John Stoltnagel, who was then the CEO, figured out that if in fact Illumina was successful at doing what they pitched us that they were going to do in their business plan, that they would need more than the world's supply of oligos in order to actually commercialize that product. Oh, sorry. Yeah. So Affymetrix, which was started in the early 90s, popularized the first set of microarrays. So looking at genes on a little slide. And they would put little snippets of DNA in specific places on those slides. The problem is that one's ability to put those snippets of DNA in specific places is constrained by diffusion. And so it gets messier the smaller the so-called feature size that you try and make is. Illumina's real alteration of it was, we're not going to worry about what we put where, okay? We're actually going to put a whole bunch of oligos, super small feature sizes, randomly on something, and we will informatically decode it. But what that allowed them to do was to put many, many more single experiments in a specific space, which dramatically ramped up the number of small DNA snippets they needed. And so they, in fact, went out and found a really early stage company that was changing the way that people made oligos, and they brought it in-house, developed the technology, then actually licensed it out to people who were selling oligos more broadly because they didn't need it as a competitive landscape, right? And brought the price down by like 90%.
So they understood that they would need this feedstock, essentially, to sort of do this. And there was no feedstock, or not enough of it. So they invested in the feedstock so they could make a profit on the underlying technology, and then license it out so that it commoditized.
Yes.
Yeah. I mean, that's the kind of thinking that you have to do when you're thinking not just one move ahead, but 4 or 5 chess moves ahead when you're looking at that. And so what is the process that brain of yours does? Like when you're thinking about this, like what do you first look at?
So, as you described a little bit, the first thing is the individual, right? The person, and it's some mix of smarts, but smarts is in pretty wide supply, right? And there's a humility about what they know and they don't know, so that they're always out searching for the truth. And it's that combined with, for me at least, really an orthogonal approach to what I think could be a big market need. And so it's those three things. And I have tried at times to say, oh, well, maybe I can invest in something that had only 2 out of the 3, and I can't ever quite make that work. So I sort of constrain myself to all 3 of them.
Now, I've talked ahead of it, and our readers or listeners, see, that's like such a magazine thing to say, readers. Our fantastic audience here and live around the world know what an incredible investor you are, but tell me where you've made some mistakes. Where did you get one of those 3 things wrong or 2 of those 3 things wrong?
Sure. So the mistake I've made most often and is sort of most damaging, right? Like irrevocable mistake, has been when there's a market need out there, and the technology is just not ready for industrial prime time. It's too complicated, right? I'll give you an example. I invested in a minimally invasive obesity company probably 15 years ago called Satiety. And they wanted to, so at that point in time, and still to some extent, people, you'll do open surgery and do gastric stapling in someone's stomach for an obese person. They had developed a means by which to go down the esophagus and do the gastric stapling from the inside. So superbly less morbidity than the open procedure, right? Yeah. Should have been awesome. It was impossible and superbly expensive to make that device. And at that point, the FDA was a little dicier about obesity stuff than they are today. That was in the FDA's swing towards the safety spectrum rather than the innovation spectrum, where they sort of seem to be more now. So we could never reduce it to practice well enough such that you could make it cost effectively and you could have the procedure be bulletproof enough for someone to do. Actually, your next person after me, Kurt Graves, on whose board I sit.
Are you doing my job now?
I'm trying.
All right.
I'm trying. I'll give you all the help I can.
Okay.
But Kurt, I think, will show you a device where they've worked super hard for the last 5 years to get that procedure to be just brain dead simple, right? Which is a part of the whole healthcare innovation side that gets lost a lot of the time.
To have it be adopted, it has to be that brain. So in a minute, I know this is, if ever there was an audience that's going to want to ask you questions, it's this one. But I want to talk about one thing that still fascinates the hell out of me. You talked about a frame shift and across the digital health spectrum from CapEx to OpEx. And we talked about in hospitals, and you described hospitals as, a big pile, 6-story pile of legacy costs. And that the future was going to be in figuring out a way to bypass those legacy costs and provide services that, from anywhere and to anywhere, and using, new technologies to avoid those legacy costs. So talk a little bit about that.
Sure. So I guess, as usual, healthcare is like a decade behind every other industry in these sorts of things. I think you see it, the end stages of it are playing out in retail today, right? For the thesis being, for many, many years, decades, the people who had the physical goods, right? In retail, it would be the shops. In healthcare, it would be the hospital beds or the MRI scanner or the diagnostic lab, whatever that was. That was the high-value real estate, right? Because there was no real way to have real-time, broad price discovery, quality discovery. There was no data liquidity in the system for an individual to make better choices, right? To the extent today that we actually have lots of liquidity of data, and you have multiple purveyors of the same CapEx that are pretty undifferentiated. Like, in all honesty, one hospital bed's by and large pretty much the same as another hospital bed, right? Certainly true for x-ray machines and MRI scanners and diagnostic labs.
Is Steve Corwin still here? Just checking. Just want to make sure that we don't...
Making friends all the time.
Great.
Okay. So to the extent that you're a primary care doc in a city where there are 5 hospitals, why wouldn't you, as a primary care doc who cares about the total cost of care and outcomes, figure out where's the cheapest place to go send my patient, where they're going to get great care, right? And I will bet you that we will get to a time where the marginal costs more represent price for those things than the fully loaded costs, because otherwise that bed or that MRI scanner sits empty during that time. The utilization rates are terrible, right? If you talk to imaging centers, like their utilization rates for those machines are certainly sub 50%. I think they're sub 30%. Like,
which is why, and they push them so much. Listen, so I want to get some questions. Please keep your, the preambles short if you would, so we can get a bunch of questions in. So, all right, we've got Adam, so we've got a bunch of people here. Yeah, thanks.
Hi, I'm an angel investor and entrepreneur. Question, everybody talks here as well about precision health as the next big thing where a lot of opportunity lies. Where is the monetization model besides regulatory changes? If we don't get those, what else have you seen?
All right, good question.
So I think that, one, I think we know about 10% of biology today, okay? And so I think when you talk about precision health, the question is specifically in oncology, right? And in diagnostics are places where precision health or precision medicine, Lloyd will want to push me to one or the other of the definitions, can be super useful where we understand really the molecular basis of disease, right? But it's a small subsection of the overall healthcare landscape. And the monetization model for those has to be super short term, because there's nobody in our ecosystem who has more than really a 24 or 36 month purview on any patient, right? It's why preventative care has been so hard in what we do. So I don't think that, broadly speaking, there's a business model for precision health for a decade, maybe more. Again, specific places, diagnostics, prenatal diagnostics has been a place where molecular diagnostics has taken off so rapidly you wouldn't even believe it, right? Mm-hmm. But there was a molecular diagnostic test for trisomies that was 99.97% sensitive and specific compared to 85% for the prior one, right? The quad screen. And that gap was enough to drive real adoption, and the healthcare economics around avoiding amnios was enough to get people to be willing to pay for it.
So trisomies are Down syndrome, tests for Down syndrome. All right, so we've got some more questions. Adam, I see you've got a mic.
Hi, Adam Lashinsky with Fortune. Bryan, you said two of the qualities you're looking for in your investments are humility or an orthogonal approach to what could be a big market need. Yet in Silicon Valley, we know that the great entrepreneurs almost completely lack humility, and they have found markets that nobody knew existed. So I'm wondering if you could analyze that, that dichotomy. Is it you, or is it medicine, or what?
I should just point out that Adam just wrote a book about Travis Kalanick. So that book is coming out.
Not a lot of humility there.
No, so that book is about to come out. Wired. Okay, May 20. This is what friends do for friends. Okay.
So it may just be what I personally look for in an entrepreneur on the humility side. If you're right, like if you and your company are born on exactly the right path, no humility needed, right? Like from here to the moon in a super straight shot, all good and done. I am always surprised 6 or 9 months into an investment about the 2 or 3 things that I learned that I could have known. Like they existed prior to me making the investment, and I don't know them before the investment. Right? There's something about being in it 24/7, like you burned the boats after you got off on the island, right? About, holy cripe, like this is super important. And if you don't have, for me, humility, seeking the truth, listening, so it's not blindly listening to people, right? You've got to sort really well. Those are all aspects that are pretty obtuse, end up being super important as you sort of bob and weave to try and find your way through exogenous variables, intrinsic variables to get to success. Your comment on the markets things. So oftentimes, stuff that I end up investing in, they aren't markets today, right? So that's actually one of the interesting imagination questions. Is the people don't have it today, right? So, you're not selling it, you're not replacing something, right? In the healthcare space, it's not, the world needs a better statin, so I came up with Crestor, right? It's, there is no market, but there can be a problem, right? Or it can be, if X then Y, there's going to be a big problem, right? And for me, the big part is the orthogonal approach, because everything I invest in spends time, frankly, screwing up for the first 2 or 3 years. And so for me, what I need is, if you're successful, you've actually got lead time on everybody else to then go screw up your commercialization approach right before you figure that out.
Let's get another question. We've got one right in the front row.
Really quick, Jonathan from Israel, run a digital health company. To your points, what do you think about the public markets? We've seen companies that IPO, and then the market doesn't know how to appreciate that because those rounds need to happen before the company sort of goes through the growth. So what do you think about IPOs for digital health companies? When and what does the market indicate to you in terms of being able to accommodate for that?
And also, when you answer that, could you just talk a little bit about your time frame for investing? What do you look at?
Oh, my time frame for investing is way too long. So I've been on Kurt's board for like 15 years.
Okay.
Right. So let's leave that. That's a long therapy conversation. The public markets. Look, in the short term, the public markets have proven again and again that they're wrong. They may be high, they may be low, right? But they're certainly reactionary, and when you are just going public, there are lots of supply-demand dynamics that get you even further off from actually true value. Like over long periods of time, the public markets are actually pretty good, right? But it's a bumpy ride there, right? Like Illumina went public at 16, went to 42, then went to 4, and now it's, I don't know, split adjusted 400, right? So like it should never have been 4, but it was. For me, the big thing for digital health companies these days is really this question of ROI and breadth of market, right? So we live in a world where you have sort of two constituencies in the healthcare system, right? You have the people who do lots of stuff and make no money. Health systems, doctors, insurance companies, like their margins are all terrible, right? And then you've got employers who pay for lots of things, right? But it's a cost center for them. For those folks, for the employers, healthcare is sort of the last great unmanaged line item for them, right? It's like supply chain, procurement, T&E, everything else. Like you're not allowed to fly super first class if you're going an hour, right? You have to do X or Y. They don't do that in healthcare. And so there's no requirement for people to adopt the sets of things that many companies are purveying. And on the other side, with the very, very low margins, sales cycles are long, retention of members and employees are short, stuff like that. So for me, the real question is, can you get these digital health companies to a place where they have not only the ROI, right, but also the breadth of use to be a mature enough business to actually be able to be a public company rather than just a public company because you need money, which is how lots of companies go public these days.
Amazing. The last great unmanaged land. I love that. Thank you, Bryan Roberts.
Thank you.
This was
Thank
such
you.
a great conversation.
Absolutely. Thank you all. See ya.